Steph, thank you so much. Pfizer shipment delays are now starting to impact vaccination targets. The province says it will not reach its goal to give all long-term care residents their first dose of the COVID-19 vaccine by Friday. Retired General Rick Hillier, chair of the province's Vaccine Distribution Task Force, joins me now with the latest on the rollout. Good morning.
Hey, good morning.
Thank you so much for joining. No doubt this is frustrating because I know there was a timeline that you wanted to work to. Friday was that date that we were hoping long-term care residents were going to have this done. The date right now, looking 5 days later, right? So February the 10th. How confident are you that you'll be able to hit that target?
We're confident. And, you know, it's not the date. It's that we want to get that level of protection to the residents of the long-term care homes and the high-risk retirement homes and the elder long-term care facilities. That's what we want to do. And I know that people are frustrated, but look, if you want to see people who are frustrated, just look at the folks around here who work with me and who I work with, who are consumed by this mission to get that level of protection out there. And not having vaccines to be able to do it is just absolutely, as you said, just absolutely frustrating. So I think we'll reach the 10 February date. It does depend upon the arrival of Moderna vaccines on Friday, Saturday of this weekend. As soon as they arrive, they'll be out and be started to be put into the arms of residents in those facilities and get them that level of protection, as I mentioned. But it's challenging when you don't have the vaccines. It's like, you know, I was a soldier all of my life, and pointless to go into combat if you had no ammunition. And right now, it's really challenging when you don't have the vaccines to be able to vaccinate people, obviously.
So our province with a capacity, and correct me if I'm wrong, we have can give up to 40,000 vaccines a day. Most of it has been hitting, I think the most is around 15,000, just under 16,000 a day. That is the most. Is that purely because of supply, or have there been other intricacies involved as well?
First of all, we had several days we went over 20,000, and deliberately just to ramp up the machine. Some of those weren't accounted for in COVAX, and they were paper-based because they were in some of those long-term care facilities and other places, and then we catch those up later on. So, but it is because of the vaccine supply. I mean, it is pointless to have a machine standing there ready to do 40,000 a day or a lot more, and we are planning on being ready to do a lot more if you don't have vaccines to put in there. And so, you know, we're down to a much slower right now. We are absolutely focused on getting second needles into the arms of those who have had the first needle. Pointless to have given the first needle if we can't complete that immunization program with the second one. We're going to do that. Secondly, we're very, very, very focused on the residents, as I talked about. But thirdly, we have an operation going in the isolated fly-in communities. We call it Operation Remote Immunity. We launched about 3 weeks ago with small numbers of doses into the arms of residents in long-term care facilities in those fly-in communities along the James Bay. And then on Monday, we had 6 teams flying in those communities, starting a rotating system of vaccinations, community by community to do some 31 communities. And we already have more than 2,000 people vaccinated up there. So that part, we keep going. We have enough vaccines to do. But again, it is frustrating. We want more vaccines. We've got a huge machine in Ontario, and we want to turn it on and challenge it and stress it and put vaccines to the people of Ontario and get that level of protection that we all want to have.
Indeed. So let's talk about the next steps here. And a lot of people are asking, so what's the next step? Once those in the long-term care resident facilities are vaccinated with that second dose, who is next in line and how does that rollout play out?
Well, we continue with our phase 1, and those in most vulnerable circumstances, our first priority, and those healthcare workers in the province, our great healthcare workers, our second priority. So once we get a higher level of vaccines, and we hope, but we do not know yet for sure, that we'll get, you know, about 140,000 from in the week of 15 to 20 February, and about that all the way through to the end of March. And the end of February, we'd get another shipment of Moderna, and then in the middle of March, get a huge shipment of Moderna. So what we want to do, and what we're really focused on, is number one, again, catching up on second doses and getting back to that 21 to 28 day window. You can stretch that window out as we are doing to mitigate the shortage of vaccines, but it is better to have that 21 to 28 day window. Then we want to step to ensuring that all the essential caregivers and healthcare workers and staff in those long-term care homes that we did not get vaccines to, and that's probably about a third of the residents, that we get those workers because we want to protect them also. And thirdly, we want to go to the retirement residences across Ontario, not just in Toronto, Peel, York, and Windsor, obviously, but right across Ontario. There are more than 700 of them. We've probably got about 200 and a little bit done now, i.e. vaccinated now with the first needles. And we want to get all of those retirement residents done. And then we've been working with the chiefs and the First Nation to lay out a priority matrix for how we do the First Nations people on the reserves, They've laid out a priority matrix, and we want to be able to start then in the first part of that priority matrix and bring vaccinations to the First Nations in Southern Ontario. And so that's where we'll roll. And then what we want to do, obviously, in that first phase before the end of March, is complete our healthcare workers, particularly those who are on the front line dealing with COVID-19 patients and at greater risk than probably any of us. And then get ready to roll into bigger numbers arriving, we hope, for phase 2 starting about 1 April.
There's a lot of conversation, of course, around education today. Everyone's awaiting the announcement from Education Minister Stephen Lecce, who's going back, who's not. We've heard a loud cry from a lot of teachers saying, listen, they should be near the front of the line, and not necessarily behind long-term care, of course, but should be right there for the front line because of their dealings with a number of individuals on a daily basis. Is there more thought being put into where they stand and when that rollout can happen for educators?
Well, look, we'd love to put everybody at the front of the line, truthfully. I mean, we really would. I'd love nothing more than to have 15 million doses of vaccines show up in Ontario and challenge us to get them into the arms of everybody, including those educators who we all hold in such high esteem. We have our first 2 priorities clearly indicated to us by the Government of Ontario, those in most vulnerable circumstances and our healthcare workers. And then immediately following that, as soon as we get more vaccines, the higher age brackets of 80 plus, because COVID-19 visits itself so tragically on that, we will get to the essential workers, of which the educators are one, but it's not going to be for a while yet, simply because we don't have the vaccines.
Yeah, indeed. And I can appreciate the limitations that you're working with right now. It's all about the supply. Retired General Rick Hillier, appreciate your time this morning. Thank you.
Thank you. My pleasure.
All right, 8:15, that's what we're sitting at right now this Wednesday morning, checking in with D&D.